AAMG is dedicated to provide the highest quality multi-specialty medical services to patients in the San Francisco Bay Area. Come sign up to be a member today. AAMG. Your choice, your health, our mission.
Hello, I'm Dr. Schuman Tam. I'm an allergy, asthma, and immunology specialist practicing in the San Francisco area in the Marin County. And it is my pleasure to be able to discuss with you some basic medical knowledge regarding asthma. So what we're going to talk about today is we'd like to talk about asthma. What is asthma? Symptoms of asthma, how the physician usually manage asthma. And then finally, we will talk about asthma, diet, and obesity. This slide shows what asthma is like. On the right-hand corner, you will see a cartoon of a normal patient's bronchial tube, which is widely open without inflammation, and air can go flow through it without any trouble. Patient with asthma will have a bronchial tube like this on the right side, showing swelling of the airway, inflammation of the airway, and constriction of the airway. When the airway is constricted, patient will have problem getting air through into the lung. If they cannot do that, the patient will have shortness of breath sensation. When you constrict even more, the patient will have a severe shortness of breath, and if you plug up completely, the patient can suffocate, and it can kill a patient with asthma. So asthma is a serious medical condition that can cause death. Asthma is very common, more common in children than in adults. Statistics show that 3 out of 10 kids will have asthma, somewhere from age infancy to age 6, usually associated with when they have a upper respiratory tract infection. Usually these children will grow out of the asthma by age 6, even when they have a cold. However, if these kids develop allergy, like environmental allergy like dust, pollen, or animals allergy, the asthma might persist into adulthood, because not only common cold can aggravate asthma, environmental allergy can make the asthma persist. So how common is asthma? The statistics show that about 1 out of 10 people in the United States have asthma. It translates to about 30 million people in the United States have the condition. So this is asthma not only is a serious condition that can cause death and disability, it is also a very common condition. This slide shows the common symptoms of asthma. Frequently, patients might have wheezing, basically because of a constriction of the airway. Some patients might have cough only because of inflammation in the airway, as I shown in the cartoon previously. And also the airway might be filled with mucus, and that can make the patient have an urge to cough. Now, some patients can have cough only without any wheezing. So chronic cough, asthma can also be a cause for chronic cough. When the airway is more constricted, the patient will have shortness of breath, and if it gets worse, the patient has chest tightness. So those are the frequent symptoms of asthma. The patient might have only one symptoms only. This slide shows some of the cause for asthma. Allergy is a common cause for asthma. For example, cat and dog danders can cause asthma. Dust mite can cause asthma. Sometimes, depending on pollen count, it might cause asthma. Right now, we have grass pollen, and grass pollination can also cause asthma if the count is high. Sometimes mold can also cause asthma too. There are other factors that can cause asthma. Pollution is another one. If you live close by to a freeway and with exposure to car exhaust, or if you live close by to factory, you might be exposed to pollution. That can also cause asthma. Some patients have exercise-induced asthma only. Some patients have emotional-induced asthma. Cigarette smoke, of course, can cause asthma. And if one do not stop smoking, one can develop emphysema in the future, a more severe form of respiratory disorders. Sometimes cold air can cause asthma. Sometimes a viral infection can cause asthma. So the list is very long. Sometimes reflux, many cause. Sometimes patients might have asthma symptoms, but might not be actually asthma too. So it is, again, very important to be seen by our primary doctor to make sure that you have the correct diagnosis and also to identify the cause for asthma. This slide shows a photograph how we measure asthma and diagnose asthma in the clinic. This is a device called a spirometer. And we ask the patient to blow in the machine, and then the computer will record how much air the patient can blow out within a second. And that actually measures the airway resistance, how bad the asthma is. This is not only for confirmation purpose, because not all shortness of breath is second-degree asthma. It also will assess how bad is the asthma, whether treatment is sufficient. Taking care of asthma is just like taking care of patient with high blood pressure. We have to measure it. Without measurement, it is difficult to treat the patient properly. Now, this slide shows a very small spirometer. We call it peak flow meter. I usually give it to a patient who is not aware of the severity of asthma. Some people just have high threshold. So even if they have a severe asthma, they cannot feel it. Those are the most dangerous patients that we deal with because they are not aware of what's going on in the lung. So by the time they feel it, they might end up actually immediately having an asthma attack and even cause death. So it's just so a lot of time I give the patient a peak flow meter so that they can measure it at home, usually in the morning. If it gets worse, it might be 2 times a day. They will be instructed to how much medication they should add when they have a lower reading or when to call the doctor, and hope to reduce the probability of asthma exacerbation. This slide shows how we find out whether the patient is allergic to anything that causes asthma. We can do it at a very young age, skin testing, basically put what the patient might be allergic to, we call allergens, onto the small needle. We scratch the skin a little bit, and within 20 minutes, we will be able to find out if the patient is allergic to anything that might be triggering the asthma. In this situation, this kid is actually allergic to dust mite. It's one of the most common allergens. And as you can see, scratching the skin can cause a formation of hive, and which can be very itchy. And when a patient inhale the dust mite allergen, same thing happens in the lung, causing inflammation, swelling, like what I showed you on the photograph earlier. And that is basically asthma. So how do physicians manage asthma? In addition to try to identify the aggravating factor for asthma, allergy, like what I mentioned previously, medication is important. There are 2 classes of medication that we give. One is a quick reliever. The other one is long-term preventive treatment medication. A quick reliever is usually in inhaler form. A common one is called albuterol. Basically, what it does is dilate the airway, relax the bronchial muscle, so open up the airway so the patient can breathe. It is very critical that patients don't know when you can have an asthma attack. Patient have an asthma attack, they don't have fast-acting bronchodilator, the patient can die from the asthma. So it's very important to carry a quick reliever. Now, if one is overly dependent on the quick reliever, that will also be a problem because the more you use it, the less effective it will be over time. And also you will be ignoring the inflammation in the airway that is the basic cause for asthma. So if the patient required to use albuterol frequently, or if the medication has not been sufficient, the patient ends up in the emergency room frequently, then we frequently prescribe a long-acting preventive inhaler, usually inhaled steroid, so that the steroid can get in the lung, decrease airway inflammation, swelling. Because it's an inhaler form, we can minimize the side effect because the medication will not travel all over the body. This slide shows basically how we treat patient with asthma. Of course, as I mentioned earlier, the kids should have albuterol available in case of asthma exacerbation. If this is not sufficient, or if it is the kid required to use it all the time, then we usually start the patient on a low dose inhaled steroid or other oral form of therapy, non-steroid available if appropriate, to prevent the asthma. If it still doesn't work, then we sometimes step up the medication, or maybe a combination of different medication together, and it still is not helpful, then your primary doctor, the pediatrician, might need to refer the kid to see a specialist like me for further treatment to pinpoint what's causing the asthma, and maybe using a more advanced medication to help the patient. This slide shows the treatment for adult, which is very similar to children. Again, a quick reliever is important to be prescribed and to be carried all the time in case of asthma emergency. And if it's not working, again, then we add a preventive medication, usually a higher dose of inhaled steroid compared with children, because it's adult, it's a bigger person. And if it still doesn't work, then we add other medication, increase inhaled steroid, and if still not helpful, a lot of time, the primary doctor might have to refer the patient to see the asthma specialist for further advanced treatment. This slide shows the 3 most common types of inhaler in the market now. Middle dose inhaler is a common one that we prescribe. It can be in the form of albuterol, a quick asthma reliever. It can also deliver a controller medication like inhaled steroid. So when a patient actually device by pushing it, the medication will be released from this mouthpiece, and the patient can inhale it into the lung. It is critical and important that your physician or the pharmacist has to teach you how to use it correctly, because incorrect usage is a common cause for treatment failure. So it's important to use it correctly. And for some patients, like for example, very young children, old patient, that they cannot follow direction exactly how to coordinate use the medicine. So sometimes we might prescribe a holding chamber to improve the delivery of the medication. This is a nebulizer. This is a machine activated by electricity. It aerosolizes the medication in the holding chamber, make it become an aerosol so the patient can comfortably inhale and get the medication in the lung. Usually prescribed for patients who is very young, infant, very young children. We cannot use the handheld inhaler to improve the delivery of the medication. With the COVID-19 coronavirus pandemic for the past few months, we have stopped using this type of nebulizer if possible in the clinic setting and also in the hospital setting, unless you're in a special room. The reasoning behind that is that if you are a carrier of the COVID-19 virus, or if you are infected, that's why you have the asthma attack in the first place. And then if you use this machine, you can potentially aerosolize the virus and infecting other people in the clinic or in the hospital. So if the patient have to use it at home, for the past couple of months, I have advised the patient to use this in a room with door closed, and nobody should enter the room for about 2 hours after nebulizers in order to prevent spread of the virus to family members. On the right side is another common inhaler we prescribe. And this is a dry powder form of inhaler. It is developed to improve the delivery of the medication, because the medication can only be delivered when the patient inhales through the device. Of course, you have to ask your physician and pharmacist how to use it, because sometimes patients can still use it incorrectly. Like, for example, one of my patients never activated the device by pushing a button to the other side, and thus never get any medication. So again, talk to your primary doctor who prescribe it, and or the pharmacist how to use the medication in order to make sure that you use it correctly to prevent treatment failure. Well, with the former medication not helpful, so primary care doctor or the pediatrician might have to refer you to see the asthma specialist or the allergist. And this is the patient that have allergy causing asthma, and the medication is not sufficient. So we this patient allergy shot basically is like an immunization. We give the patient what they're allergic to, like cat dander or dust mite, and try to make them immune to the stuff they're allergic to, and thus prevent the asthma. And for past 10 to 15 years, we also have man-made antibody that can reduce the allergy in the body and thus reduce asthma. In the past few years, we have other biological man-made antibody available for the treatment of asthma. All these specialized medicines are usually given by the asthma specialist. So if the treatment is not sufficient with traditional means, with medication, inhaler, your primary doctor might have to refer you to see the asthma specialist for this type of more advanced treatment. Now, we'll talk about obesity. Now, of course, if you don't have a healthy diet, you might increase the risk of obesity. Of course, exercise is also important too. So obesity can affect asthma adversely in two basic mechanisms. One is mechanical, one is immunological. Mechanical is basically if you have obese, your lower abdomen will be big and it will impair airflow into the lung. And if you're already compromised with asthma, it will make the asthma symptom much worse. The other mechanism is that fat tissue can also produce a mediator that can cause more inflammation in the lung. So preventing obesity is also an important way that we don't want the patient to be obese in order to control the asthma better. Of course, if you're allergic to certain food, you might have to avoid the food that you're allergic to because that can aggravate asthma. And a lot of time you have to do testing to find out exactly what food you're allergic to. This slide shows the healthy diet. Of course, vegetable, fruit, eating those will reduce the chance of obesity. These are the example of common food. Food rich in vitamin D, I think is important, especially milk. So if you can tolerate milk, drinking milk will help to reduce the chance of vitamin D deficiency. If you have low vitamin D, most of the time the asthma medication might not, the inhaled steroids in particular might not work as well. Of course, food that are not healthy, high fat, can increase the chance of obesity, and this food should be avoided if possible. This slide shows the common food allergens. So this is because the patient is allergic to the food. When they ingest that can cause allergic reactions, sometimes asthma, sometimes anaphylaxis. The most common food allergens in children are milk, egg, wheat, and soy. I mentioned that milk with vitamin D is helpful for the patient to prevent vitamin D deficiency. However, if the kid is allergic to milk, drinking it might aggravate the asthma or worse, anaphylaxis. To find out whether the patient is allergic to that, skin testing or blood test is necessary to prove the allergies together with history. Other food allergy include shellfish, fish, or nut, and that can be present in children and also in adults. Again, skin testing and laboratory tests might be required to confirm the diagnosis. Frequently, patient they will have some skin manifestation like hive or eczema as a clue to make the physician suspect food allergy as a cause for the condition. Now, sulfite is a preservative that can also aggravate asthma. It can be present in wine, alcohol, and also processed food. And this sulfide, when it enters the stomach, it will turn into a gas called sulfur dioxide that ascends into through the esophagus, the eating pipe, and then the patient can inhale it to the lung, causing bronchospasm. So if the patient reacts easily to the medication, that also gives me information because that means the airway is too inflamed. So I might elect to treat it so that it won't react that easily with sulfite. Of course, if you can minimize sulfite ingestion, that also reduces risk of exacerbation of your asthma. So this slide shows how to avoid, if you're allergic to certain food like nut, or meal, egg, what you need to do, you need to read the label carefully so you won't ingest the food that you're allergic to. When you go out to eat, you have to inform the waiter, the waitress that you're allergic to the food, so it won't be, that your dish will not be cross-contaminated with the food that you are allergic to. So that is important to prevent exacerbation of your food allergies. So in addition to avoiding food, the other treatment that I want to re-emphasize again is that it is important that you carry a fast-acting reliever, the albuterol, and keep it with you at all time because asthma attack can happen anytime. You don't have the inhaler available, the quick reliever. The consequence can be serious. And asthma can suffocate you, it can cause death. So always carry an inhaler with you, a bronchodilator, the albuterol. Now, if you need to use it frequently, then you have to contact your physician because you need to have additional medication so that you are not overly dependent on it. And you remember, this is the quick reliever is a medication for emergency. If you use it all the time, then it will stop working. Then you get into quick trouble. So you have to utilize a few long-term preventive medication to prevent the attack. So as always, consult your doctor to make sure that the symptom that you have is actually asthma, is not something else, and that the treatment is appropriate. Identify what you're allergic to, whether you're using the medication correctly, and they're all important. So consult your physician for the treatment. Work with your physician for the treatment. And that will conclude my talk, and I will welcome any question that you might have for me. Thank you.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like, and subscribe to our channel for more related content.